Hi everybody, Dr. Ellie Stein here with a video tip for August 2025 all about vitamin D and chronic pain. The question I'm asking is, does vitamin D supplementation benefit people with chronic pain? If it does, it would be a safe, inexpensive strategy. If it doesn't, it would be a waste of money. So first, a little bit of background. Although it's called a vitamin, vitamin D is actually a hormone. Vitamins are things you have to eat, things like the B vitamins, vitamin C, etc. But vitamin D is, like other hormones, is actually made in the body, in the skin, to be specific, when we get exposed to ultraviolet B light. Now, once vitamin D, or really to be more accurate, the precursor of vitamin D is formed in the skin, that precursor travels throughout the body. It goes to the liver and then to the kidneys, where it's made into the active form of vitamin D, also called calcitriol. Calcitriol binds to something called the vitamin D receptors. They're found throughout the brain and the body. And those receptors, when activated, regulate hundreds of genes. It's estimated that up to 10% of all of the genes in our body are impacted by vitamin D. Some of the important effects of vitamin D include bone health, calcium balance, our immune system, cardiovascular health, mood and motivation, even the risk of getting cancer, and our insulin sensitivity. So it has some very significant impacts. There's no doubt that vitamin D is a critical hormone for many aspects of human health. So what is the connection, if any, between vitamin D and chronic pain? There have been many studies over the years showing that people with chronic pain are more likely to have insufficient vitamin D levels, and people with sufficient vitamin D levels are less likely to have chronic pain. So what do I mean by the words sufficient and insufficient? There have been decades of controversy and debate about what is a normal or sufficient or healthy vitamin D level. And of course, what I'm going to tell you right now is subject to change. Now, what makes it a little bit confusing is that we use different units in the US compared to the rest of the world. So if you live in the United States, the measurement is in something called nanograms per mil, and a sufficient level is somewhere between 30 and 50. So if you get a vitamin D test done at the lab, that's the range that you're aiming for. If you live in Canada, Europe, or really anywhere else in the world, we use different units. We use SI units, nanomoles per liter, and the normal or sufficient range in SI units is somewhere between 75 and 125. Now, we don't know exactly for sure why there is this connection between vitamin D and chronic pain. We know that vitamin D impacts inflammation, pain modulation, and even our endogenous opiate system. So these may explain the connection. Not all types of pain seem closely correlated to vitamin D. The ones where the research is the strongest include arthritis, chronic muscle pain, and chronic widespread pain, including fibromyalgia. The connection between vitamin D and other types of pain like headache and neuropathic pain are a bit less clear. A really important point is that just because two things correlate doesn't mean one thing causes the other. So, for example, just because people with low vitamin D have more likelihood of chronic pain doesn't mean the low vitamin D is causing the chronic pain. It could be, for example, that people with chronic pain don't get out as much and therefore have less exposure to the sun, and it's actually the pain that's causing the low vitamin D. Another possibility is that some other variable, not pain and not vitamin D, is causing both things. So, for example, This could be poverty, overwork, or life stressors. It could also be that vitamin D is a stand-in or biomarker for some other variable, and I'm going to comment more on this in a few minutes. Now, vitamin D deficiency or insufficiency is really common, especially the farther away from the equator you live, and especially in the spring after there's been even less sun exposure. So, for example, in Canada, in the spring, 73% of men and 77% of women have a vitamin D level in the insufficient range. People with darker skin are more likely to have lower vitamin D levels because the melanin that makes our skin a little bit darker blocks the absorption of the ultraviolet light. Another consistent finding is that people that eat or drink foods that are fortified in vitamin D, so the most common of these is dairy products, are unlikely to be deficient. So getting vitamin D in your food is a good strategy to increase your levels. So now the question arises, given that most of us are probably vitamin D insufficient, say if you live above the level of Atlanta, Georgia, above the 30th parallel, should we all be supplementing? Now, I've been to many conferences over the past 25 years where I've heard this debated. And many of the presenters, when it became apparent that so many of us were deficient, they recommended supplementing with vitamin D. But it turns out that that recommendation may not be correct. Why? Because there's many recent trials looking at vitamin D supplementation in people with chronic diseases, including chronic pain, and the evidence is not convincing that it's beneficial. Some studies show improvement and others do not. So just because something like vitamin D is low, and that low level is correlated with pain, it does not necessarily follow that giving more vitamin D is going to solve the pain problem. So what would be, we'll say, an uncontroversial recommendation? Probably one of the most recent guidelines comes from the Endocrine Society in the United States. They just updated their guidelines for vitamin D testing and supplementation in 2024. One of the big findings is they recommend against routine vitamin D testing. I'm not 100% sure of the reasons. I think it's because they feel that so many people are deficient that it may not be cost effective to continually test everyone. And because of the research that if you supplement vitamin D, it won't necessarily improve your health. In Canada, we have a program called Choosing Wisely, which informs which tests the provinces decide to pay for, and vitamin D has been taken off the list. So if you live in Canada, it's really difficult to get your vitamin D level tested. So here are some of the recommendations from the Endocrine Society saying, in general, they do not recommend global supplementation, but there are a few groups in whom they feel it would be beneficial even without testing. One group is in children, and that's because vitamin D helps decrease the risk of getting respiratory tract infections. Another group is people over the age of 75, because vitamin D, again, strengthens the immune system and may be beneficial for bone health and decrease the risk of breaking a bone. It's recommended in pregnant women because it decreases the risk of many serious pregnancy and birth outcomes, including fetal death. And the last one is they're recommending it in people with prediabetes because it may reduce the progression to diabetes. So how much should you supplement? The range for these different groups varies slightly, but for most people, somewhere between 400 and 2,000 international units would be appropriate. Obviously, small children would be on the lower end. If you're a darker skinned person and you work indoors, you might want to supplement towards the higher end of that range. If you're less active and you're at increased risk for osteoporosis, again, you may want to take 2,000 or more units. But if you eat a lot of fortified foods like dairy products, you may not need as much. Now, what was really interesting when I read different guidelines from different organizations, including the Endocrine Society, they don't mention the safest and cheapest way to increase vitamin D levels, which is sunlight exposure. So why is it that sun exposure isn't mentioned in these guidelines when we have ample evidence that sunlight exposure is incredibly beneficial for health? I'm just going to list a few of the benefits. And some of these benefits are in part due to vitamin D, but some of the benefits from the sun are not due to the impact on vitamin D. Some of them are the sun exposure improves immune function, it lowers blood pressure and improves cardiovascular health. It increases our endogenous endorphins, so that improves our mood and reduces pain. The sun improves mood also through increasing serotonin. It regulates our circadian rhythm so that all of the parts of our body work in sync with each other. Infrared light from the sun increases the production of melatonin, the body's #1 antioxidant, which helps decrease inflammation and repair DNA, and this may be related to the benefits with respect to cancer risk. Infrared light also improves energy production through direct effects on the mitochondria. Now, these are cellular effects, and you might say, okay, but is this actually going to improve my health? And the answer is a resounding yes. One of the really striking findings that I found is sun exposure decreases death rate by all causes by up to 15%. That's very significant. It specifically reduces deaths due to cancer, including melanoma, colorectal, breast, prostate cancers, and lymphomas. It decreases cardiovascular disease, that's heart disease and stroke. It decreases the risk of Alzheimer's and other forms of dementia. It decreases the rates of autoimmune diseases like multiple sclerosis, and it decreases metabolic syndrome and type 2 diabetes. Now, you might already have bells going off in your mind thinking, yes, but isn't the sun dangerous? Aren't we constantly told to stay out of the sun, to cover up, wear sunscreen and sunglasses? People are scared that the sun exposure will increase their risk of melanoma, a potentially fatal skin cancer. However, it is true that sunburns do increase the risk of melanoma, especially if those burns occur in childhood. But there's increasing evidence that non-burning chronic sun exposure may be protective overall. And this comes from multiple studies finding that outdoor workers have lower rates of melanoma than indoor workers. This is concerning because in North America, most of us spend 96% of our time inside. Now, why would sun exposure potentially be protective even against melanoma skin cancer? It's because of the increased rate of melanin and melatonin in the skin, both of which are protective. So the research suggests that the dangers of avoiding the sun are greater than the risks. Again, to repeat, people who avoid the sun are 15% more likely to die from all causes, and outdoor workers are healthier and live longer than indoor workers. So then the question arises, is there any such thing as safe sun exposure? And the answer is yes. It is possible to stay outside enough, getting moderate non-burning sun exposure, especially during the summer months, to increase vitamin D levels so that they'll stay above the 75 if you're using SI units, or the 30 if you're using American units year-round. This can be achieved by being outside for about 1 hour per day during the summer months. Now, I've heard from many sources that this is only possible if you live kind of within the 30th parallel, meaning close to the equator. But I recently heard a podcast in which they're saying, actually, because of different bending and refraction of light, even if you live above the 30th parallel, in the winter, you're still getting exposure to some ultraviolet B light. And because vitamin D is fat soluble, it stays in the body for long periods. It's not like B vitamins or vitamin C, where you take it in, it does its job, and then you excrete it. It stays in the body. Now, I've done a couple of short YouTube videos talking about how to build your solar callus. So how to get this moderate gradual sun exposure, building a tan to protect you against more intense exposure. So you might want to check out some of those videos. So now we're down to the critical question. Vitamin D is important for health. Low vitamin D and chronic pain are correlated, but we don't know if one of them is causing the other. Vitamin D and sun exposure are both very significantly beneficial for health. And sun exposure may not be as dangerous as was previously thought, but the question still remains, does exposing ourselves to the sun potentially reduce pain? There's some studies, they're mostly small, and there's not a lot of replication, showing that light therapy, what we call photobiomodulation, with red and infrared light, as well as bright white light and even green light, show benefits for chronic pain, including fibromyalgia. Now, unfortunately, most of the studies on light and chronic pain are using artificial lights, and there's much less research on sun exposure. I'm in favor of sun exposure because it has so many benefits. It's always present, even on cloudy days. It's free and it's easily accessible. Unfortunately, because no one can patent the sun, there's no companies that are likely to fund the desperately needed research. Could you figure out, in the absence of research, whether sun exposure is beneficial for you? You could buy a whole bunch of arrays of differently colored lights, or you could go outside more. If you want to try sun exposure, I recommend what I call an N of 1 experiment. N means the number of people in the study, and 1 means it's just you. So how would you do this? You would record what your pain levels are now, out of 10, where you have pain, etc., and perhaps the ways in which your pain is interfering with your life. You could then arrive at a solar treatment plan for yourself. What I would recommend is try to get outside for 10 minutes or longer first thing in the morning, within an hour of sunrise. Unless you live so far north that in the summer the sun rises at 2 a.m., you want to get up at a reasonable time. You want to then try to get out somewhere around midday for about 1 hour. You don't have to be in the direct sun for all of this. And then perhaps another 10 minutes at dusk. This gives you sun exposure to all the different frequencies of light, enough of the intense light in the middle of the day to raise your vitamin D levels. And then you try it for, say, a summer, and you see how you feel. Does it make a difference to your pain or any of your other health symptoms? And lastly, let me know what your findings are.